researcher at UCSF at our Zuckerberg San Francisco General Hospital. I'd like to start off with our land acknowledgement. We would like to acknowledge the Ramaytush Ohlone people who are the traditional custodians of this land. We pay our respects to the Ramaytush Ohlone elders, past, present, and future, who call this place, the land that UCSF sits upon, their home. We are proud to continue their tradition of coming together and growing as a community. We thank the Ramaytush Ohlone community for their stewardship and support, and we look forward to strengthening our ties as we continue our relationship of mutual respect and understanding.
Okay. So I'll take it over from here. I'm Nancy, the project manager for the Champion Provider Fellowship. So before we begin, we want to go over some housekeeping. So we want to keep everyone muted through the course of the presentation. If you have any questions or general comments, please use the chat box to send them to us. We'll be monitoring this chat box throughout the presentation. This webinar will be recorded and we will post these slides as well as a handout by next week. And for best viewing, we recommend that you use your computer audio and maximizing your Zoom screen. And if at any point you're having any technical difficulties, you can message me. And here are some upcoming events. We have our quarterly Works in Progress calls on November 18th. And then we will also have a quarterly local health department check-in on November 21st. These events are posted on our website at the link below, and you can register by going to that page. And I also want to announce that we are in our recruitment period right now. Our applications will open for the 2025 cohort recruitment next Tuesday on October 1st. And here is a brief timeline. We will be hosting a clinician Q&A webinar on the 24th. That would be during the lunch hour from 12:10 to 12:50. And then the application deadline is December 13th at 5 p.m. And we'll announce the new cohort on February 2025, and the onboarding is June 2025.
Great. With that, I'll introduce our speaker for today, Dr. Christina Hecht. Dr. Hecht is a senior policy advisor at the University of California Nutrition Policy Institute, or NPI. She earned her BA at Stanford and PhD at Johns Hopkins School of Hygiene and Public Health. The primary focus of her work is healthy beverages. She leads NPI's work in drinking water safety, access, promotion, and policy. She's a co-investigator on current research in the area of drinking water and is active in multiple collaborative projects. She coordinates the National Drinking Water Alliance, a network of individuals and organizations across the country working to ensure that all children in the U.S. can drink water in the places where they live, learn, and play. She's also a founding member of the UC Research Consortium on Beverages and Health. And we're very excited to have her today. And I was just sharing that, this all started with a lot of really great questions from this cohort, I think back at our media training, advocating for us really expanding our focus in understanding access to safe drinking water as part of the work around reducing and improving the consumption of healthy beverages. And so really excited to have you today.
Thank you both, and good afternoon, everybody. I'm very pleased about your interest in drinking water, so here we go. Next slide, please, Nancy. As already mentioned, I work at UC NPI, and we also coordinate the National Drinking Water Alliance, so there are screenshots of our websites in case you're interested in digging into them. Next slide, please. Okay, I know that beverage choice matters is not news to you all. But which of these varied concerns might be a bridge to your patients' viewpoints? Sugary drinks are harmful to humans. You know their added sugars and empty calories make them a risk factor for a list of chronic diseases, including type 2 diabetes and cardiovascular disease. But studies suggest that talking about diabetes often hits home more than talking about weight. Sugary drinks also incite disparities. Targeted marketing of sugary drinks to youth and communities of color leads to disparities in consumption, which can then exacerbate disparities in health. So that may be a hook. And finally, sugary drinks are also harmful to our planet. Both the packages they come in and their content have a heavy environmental impact. For many people, that's the hook. Next slide, please. As you know, today's session has 4 objectives: to recognize the factors that facilitate and support choosing water, to explain key concerns about drinking water safety, then to dig into what is known and what is being done about lead in California tap water, and finally, some resources and tips. And I just want to say that this poster, and I put the website URL in your handout, is from Alaska's Department of Health and Human Services, where they have done a lot of work on promoting healthy beverage choices in their Play Every Day campaign. Okay, next slide, please. So we'll start with the elements that enable drinking water. Slide, please. Our research and advocacy work has led us to sketch this pathway to enabling drinking water. First, water must be safe, and people must have confidence that it's safe. Those will be the major part of today's conversation. Second, they need what we like to call effective access to water. That means not just that the tap is there, but that it's in a good location, it's in good condition, tap water is affordable, etc. Third is education and promotion about beverage choice, and all of these should be supported by policy. The illustration is a school water fountain, again in Alaska. You can see that it provides water that students can and will drink. Slide, please. I want to mention a new study. It supports former studies that show that ensuring access to drinking water plus education and promotion is the best way to increase consumption. But a randomized controlled trial just concluded in California elementary schools included an intervention to improve access and provide promotion of drinking water. Not only were there significant improvements in water intake, but also by the study's conclusion, the intervention students had a lower odds of overweight. Throughout my presentation, I've placed banners like the green one here that highlight key policies to support drinking water at the California and federal levels. You'll see throughout the presentation that California has frequently been a policy leader for water. Our school and childcare laws passed in 2010 were picked up and added to that year's Child Nutrition Program reauthorization, the groundbreaking Healthy Hunger-Free Kids Act of 2010. Now, California's AB 2638 of 2022 asks schools to promote and educate about water. So these are some of the policy hooks that we work off of in advocacy for drinking water. We can talk more during the Q&A if you have questions. Next slide, please. So now the meat of today's session, drinking water safety. I'll start with some background, and then in a few minutes, we'll move on to look specifically at lead. Slide, please. As you know, most of us receive water from a public utility, public or private utility, I should say, although about 1/10 of households use well water. In either case, water quality depends on the initial source of water and then any treatments that are applied, such as filtration or chemical additives. In this presentation, I will not address well water because its quality is the responsibility of the well owner. Water is delivered to the utility, from the utility to the building via water mains. You can see in this schematic, and then a service line from the water main to the building, whether it's a home, school, etc. And I put in the banner the key US laws that govern drinking water safety: the Clean Water Act, the Safe Drinking Water Act, and EPA's lead and copper rules. Slide, please. I think it's most important to know and convey that most California water systems meet drinking water standards, federal and state standards. California has over 3,000 public and private water utilities that serve almost 40 million people. In any given year, it's true that several hundred fail to meet health standards, and the map gives you a sense of the failing systems in California. This is about the same proportion as failing systems in the US overall, and they are typically in rural or low-income areas. Slide, please. I do want to glance at some of the top contaminant concerns here in California, though I won't go through this chart in detail. Naturally occurring contaminants such as arsenic, as well as those introduced by human activity such as nitrate, which is mainly from nitrogen fertilizers and manure, are more likely to be problems in water systems that rely on groundwater as a primary source. And you can see the EPA maximum contaminant level for each of these items, as well as the public health goal, the PHG. Science continues to identify emerging contaminants, and again, California has tended to lead the way nationally on regulating these. For example, California has introduced increasingly stringent regulations for hexavalent chromium, and in fact, just set the legal limit even lower in April. We all know about growing concerns about the presence of widely used industrial chemicals known as PFAS, the per and polyfluoral alkyl substances, in many groundwater basins, and state and federal agencies have begun coordinating to identify these and set standards. Again, in April, the EPA released regulations for 6 common PFAS. And finally, 1,2,3-TCP has been regulated in California since 2018, even though there's no federal standard. Next slide, please. Well, despite the fact, as I just told you, that most tap water meets health standards, many people do not trust their tap water. So I thought it's of practical importance to all of you about how to help with mistrust of tap water. So first, let's look at what the research shows are reasons for mistrust. First, poor organoleptics are a prime reason for distrust. Organoleptics refers to water's taste, odor, smell, or color. And these characteristics often mean that not only do consumers not like the aesthetics, but they read that as being unsafe. The next series of reasons center around experience with actual safety problems. Of course, there could be actual quality failures within the consumer's current area, or quality issues in the consumer's past, including for immigrants from other countries. Or it may just be from hearing about safety failures in other areas. For example, the Flint water crisis was documented to negatively impact consumers' perceptions elsewhere. Finally, studies also show that a lack of familiarity with your water source is another barrier to trust. Farther upstream, feelings of low trust in government and public agencies and services are shown to correlate with poor expectations of water quality, as does a general history of marginalization. Nancy, will you click, please? So what can you do to help? In terms of organoleptics, teach about the difference between potable or safe water and palatable or tasty water. When it's an issue of palatability, suggest chilling the water or infusing it with a slice of fruit or vegetable or maybe an herb sprig. Filtering is another option, and I'll return to the issue of filtering later. When it comes to concerns related to actual safety, the first step is to understand the issues. Use the Consumer Confidence Report, known as the CCR, to get the facts on utility water quality. Again, I'll come back to the CCR later. Also, many utilities offer a variety of consumer education, tours, videos, kids' activities, and more. Knowing and trusting your utility is valuable. If there are actual safety issues, of course, it's critical to deal with them, typically by some type of household filter device, or if need be, purchasing packaged water, which is usually the most expensive solution. Regarding the more upstream influences on mistrust, my own opinion is that those feelings need to be recognized and respected. But beyond that, educating on actual area water quality and knowing the local utility can be helpful. Slide, please, Nancy. So let's turn to lead, our main topic for today. Slide, please. I'm sure you all know that children, particularly those under age 6, are more vulnerable to lead because of their higher gastrointestinal absorption and because they ingest, drink, and breathe more per body weight. Also, the plasticity of the young brain makes it more susceptible to damage. Lowered IQ and behavior problems can result from even small amounts of lead exposure. Slide 15. Nancy, slide, please. Which is slide 15. Let's look at what we know about children's blood lead levels. The US has made significant progress in reducing children's lead exposure, demonstrated by their decreased blood lead levels. From the NHANES survey program, so the first set of bullets there, the median blood lead level for children under 6 was 15 micrograms per deciliter. In 1976, whereas in 2019, it had dropped to 0.6. Meanwhile, looking at the 95th percentile or highest category blood lead level, it fell from 29 micrograms per deciliter to just 2.1 over the same time frame. Of course, we must recognize that there are disparities by race and ethnicity and income. Now let's look at CDPH surveillance data in California. 98% of children in California under age 6 have a blood lead level under the reference value. However, and you can see this in the map, 13 counties report that more than 3% of children have a blood lead level over the reference value. Of note, in 2021, CDC lowered the reference value from 4.5 to 3.5 micrograms per deciliter. Next slide, please. So those figures were related to lead from all sources. Drinking water is an important, but not the primary source of lead exposure. Lead-contaminated dust remains the primary source of lead exposure for US children. Tap water exposure to lead is commonly estimated to be up to 20% of all exposure. If you're interested, though, I put a cite in the slide notes for more refined estimates by age using EPA modeling techniques. And by the way, all of my citations, the full citation are in the slide notes, which you'll get from Nancy. Slide, please. I want to emphasize that risk of exposure to lead from water is highest for infants and toddlers who are fed exclusively or primarily with powdered formula that is reconstituted with tap water. When you think about it, they consume up to 4 cups per day of formula made with tap water, leading to the potential for higher exposure relative to body weight. Slide, please. Now I'm going to spend a little bit of time on this slide to look at the factors that influence the potential for presence of lead in tap water. The essential factor is presence of lead in plumbing parts. Water can come in contact with lead if there is a lead service line, the pipe from the water main to the building, or lead in premise plumbing, for example, solder, taps, and fittings. However, legislation has successively reduced the amount of lead allowable in plumbing parts, and lead solder is banned in 1986. This is why building age, as a proxy for plumbing age, can be a predictor of lead in tap water. I want to add that lead service lines are narrow diameter and don't carry enough water to supply large buildings. So despite what you may hear, they are rarely used to supply school building water. And of note, EPA has set new requirements for lead service line inventories. So they're building this out in California, but by and large, lead service lines are less common in California. Okay, the next factor is the corrosivity of water, which is water's ability to corrode piping. Water corrosivity is a factor of water chemistry, the chemistry of the source water, and different source waters have different chemistries. Utilities test for corrosivity and they treat with corrosion control that effectively forms a kind of skin or coating on the inside of pipes that impedes lead from leaching out or flaking off. It was poor corrosion control when their source water was changed that set off the problems in Flint. Stagnation time is the amount of time that water sits in plumbing pipes and hence in possible contact with lead. The longer that water sits in contact with lead, the more lead may leach into the water. Rarely, particulate lead is found in water, and this is usually from a mechanical disturbance to a plumbing system. That's when you see those very elevated lead levels in a water sample. This is why flushing to bring fresh water into pipes can effectively mitigate lead exposure, and I'll show you an example of that in California schools in a few minutes. The action level is a predetermined benchmark for an allowable lead level. Where the action level is set determines when the alarm is raised. And finally, testing tap water for lead is the only way really to assess the concentration of lead in the water. Lead testing uses something called a first draw sample in order to maximize the likelihood of detecting lead. In other words, before flushing of any pipes. So you have to keep in mind when you see drinking water lead test results, those are from that first draw sample. Slide, please. I want to give you a quick look at the array of action levels that are used by states as well as recommendations. CDC states that no safe level of lead in blood has been identified. Health advocates often state there is no safe level for lead exposure. I leave it to you whether those two statements mean the same thing. AAP has recognized this in saying that schools should strive for less than 1 part per billion in their drinking water. As you know, we don't have a consensus on a health-based action level for lead. FDA has set a limit of 5 parts per billion for lead in bottled water, while WHO considers 10 parts per billion acceptable. In the US, the 15 part per billion action level for water systems under the lead and copper rule is a trigger for treatment, that corrosion control I mentioned, rather than a health-based or exposure level. California law, as of 2018, sets an action level of 5 parts per billion in the first draw samples in California licensed childcare sites. For schools, we currently have a 15 part per billion level, although AB 1851, which is currently in the suspense file, would lower the school level to 5 parts per billion. Okay, that's a lot of information. In the next few slides, slide please, Nancy, I'll present what we actually know about lead in tap water. So first, a national look. I believe that a 2018 study I was part of is the only peer-reviewed national study to date that provides evidence of the magnitude of our lead problem. In this study, we looked at the 24 states that had any state-level program or policy for school water lead testing at that time. That was 2018. After Flint, states started stepping up and doing things. My main message to you with this slide is to observe the variability in lead levels in school drinking water and to see how well California fares relative to other states. California is that little brown line. It's second from the bottom on the right side. We are looking here at schools with any report of at least 1 tap in the school with elevated lead. Believe it or not, out of the 24 states, only 6 states and DC had available data down to 5 part per billion concentrations. So look at the points on the right side of the graph. You can see that Nevada and California had the lowest percentage of schools with any first draws over 5 parts per billion, Nevada slightly lower. But you can also see that Massachusetts and Washington, DC, as an example, had the highest percentage of schools, almost 80%, with any first draws over 5 parts per billion. In terms of legislation, thanks to the WIN Act of 2016 and ongoing congressional appropriations, now every state is somewhere in the process on voluntary testing for lead in school and childcare tap water. And thanks to the Infrastructure Investment and Jobs Act, also known as the Bipartisan Infrastructure Law of 2021, the federal government now also provides funds for lead remediation in school and childcare drinking water. So this was a huge win. And another round of funding was released last month. Slide, please. Now let's look at what we know about lead in California drinking water. We have some information from 3 settings: schools, licensed childcare, and homes. I'll start with schools because that's where we have the most information, including a couple of peer-reviewed studies. Led by pediatrician Anisha Patel at Stanford University, several analyses of California school drinking water lead testing have been performed. First of all, a medical student analyzed all the available data across the entire state, and her results aligned with the State Water Resources Control Board analysis and our national study that I just mentioned, that less than 5% of all California schools had 1 or more taps with lead above 15 parts per billion. Click, please, Nancy. Second, a partnership of Stanford University, the University of California, NPI, where I work, and Virginia Polytech investigated drinking water quality. We used a previously developed representative and randomized sample of 240 California public schools. Now, I'm going to highlight 3 takeaways from this table. So first is the importance of the denominator in assessing the problem. The top 2 rows in the table look at schools, and the bottom 2 rows look at taps. You can see that when you look at schools, the problem looks worse. But I believe a child's risk level is more accurately sensed from looking at the tap level data, because a sip of water comes from an individual tap. And remember, these are first draw samples. Okay, click please, Nancy. Second, the 45-second flush results suggest that flushing was effective in reducing lead levels in the majority of cases. You can see that at any lead concentration level, whether schools or tap data, the flush sample has a lower risk. Okay, click please, Nancy. And finally, you can see that applying stricter lead action levels will markedly increase remediation needs and therefore costs. This study, our study, suggests that if the AAP recommendation of 1 part per billion were to be applied, perhaps 3/4 of California schools would be required to take steps to remediate their drinking water lead levels in at least 1 tap. And something approaching half of all taps would need remediation. So these are some of the interesting nuances that come into play as we look at lead in tap water. Click please, Nancy. California has had several rounds of legislation for lead testing of school drinking water. You've probably heard about some of these. First, there was a 2017 State Water Board request that utilities test 5 taps in each school that they serve. Then AB 746 was passed that required one-time testing at all schools built before 2010. Both of those kept the action level at 15 parts per billion in line with EPA recommendations. Last year, Assemblyman Holden offered AB 249 that would have required utilities to test every tap in every school one time in their service area, and would lower the action level for remediation to 5 parts per billion. But that bill was vetoed. This year, Mr. Holden proposed AB 1851 that calls for a pilot testing program, and again would lower the action level to 5 parts per billion. That bill is currently in suspense, I believe, for financial considerations. And remember, as I pointed out, as we lower the action level, it will increase the need for remediation. Slide, please. Now let's see what the childcare data tell us. California's AB 2370 called for testing in all licensed California childcare and set an action level of 5 parts per billion. The state report should be released next year, but my calculations in the table here suggest that less than 8% of all taps had lead above this low 5 part per billion action level. Now, by the way, you may have heard about the San Diego Child Care Center that had an extreme lead level of 11,500 parts per billion. It was probably a flake of lead in the first draw sample. However, this was only one tap out of many taps in the facility. Advocates have cited that a quarter, 1 in 4 child care centers had an outlet that exceeded the 5 parts per billion limit. And that is, the math is accurate. But as I noted, in terms of a child's exposure, it is more accurate to express findings by taps, as I've done here, rather than by site. Okay, slide please. Finally, we can get some clues about how pervasive lead is in California tap water by looking at state water board data from the testing that utilities are required to do in homes. This testing is done in order to determine corrosion control strategies by each utility. And in principle, utilities test at the most high-risk sample of homes in their service area, for example, older buildings. What we see from these data is that 95% of these homes gave a water sample, first draw sample, with less than 5 parts per billion of lead. And fully 99% of all samples were below the 15 part per billion action level set by EPA. So, I leave it to you to think about how bad you think the lead issue is in the state of California. But I like to say that unsafe tap water is a function of time and place. We don't want to ignore that there are times and places when tap water is unsafe. But I think what I presented shows that most of the time our California tap water is safe to drink. So the outstanding need is to continue to identify and deal with a situation where it's not. All right, next slide. Now I'll move to our 4th objective, which is some tips and resources for educating communities. And I'm going to mention a couple of action opportunities too. Slide, please. This is my recommended resource for beverage counsel to families. The Robert Wood Johnson Foundation Healthy Eating Research convened the organizations listed here to develop expert beverage guidelines for ages 0 to 5. The bottom line is that children under age 6 do not need anything more than age-appropriate amounts of milk and plain water. The website is in your handout. They have so many resources, including videos and fact sheets in multiple languages. A new expert panel is currently working on recommendations for children and youth. Next slide, please. I talked earlier about utility water quality and mistrust of tap water and said that a key first step is to know the local utility and read its annual water quality report. The CCR is required by law. Like the pictured sample report from the National Sanitation Foundation, the CCR tells where your water comes from, and it provides detailed information about all microbials and chemicals in the water over the past year. There are several good resources to help folks learn how to read the CCR. EPA has a simple one-pager, and again, everything is in the handout. Next slide, please. Second, everyone should practice basic water safety to reduce lead risk. Lead can only enter water, as I've told you, when there is lead in plumbing parts or a lead service line. These are highly dependent on building age and any subsequent renovations to plumbing. Only use water from the cold tap for drinking and cooking, because the hot water tank can be a kind of sink or a collection point for lead. Clean tap aerators, that's the mesh screen on the tap, by taking the aerator off, soaking it in vinegar, and removing all the trapped grit. Fresh water, as I've shown you, water that's circulating is going to be safer if there's any lead risk. In terms of regulations, and I'm sorry, the text is a little off kilter in that banner. EPA's lead and copper rule regulates lead in plumbing, and a new and more stringent rule is due out next month. But here's another place where California is leading the nation. Assembly Bill 100 took effect in January of 2023. And California has a new standard, NSF 61, that says that no one in California may continue to manufacture or sell plumbing devices that could leach more than 1 microgram of lead per liter of water. They call it Q less than or equal to 1. So that certification mark must be clearly visible on packaging. Next slide, please. I told you that I would help, I would help you understand how to help people with decision-making on filtration. Many people are keen on the idea of filtered water, and used correctly, it can be a good way to improve water quality. The first step is to determine actual water quality. Use the CCR and lead testing if appropriate to determine potability. Palatability, of course, is a matter of personal taste. So the filters are made to remove a variety of contaminants. Standard 53 for health effects removes contaminants like heavy metals. Standard 42 for aesthetic effects improves palatability. Filters should always be certified to NSF standards. But there's some potential negatives too. It's crucial to remember, in my opinion, it's crucial to remember filter cost. Also, the importance of timely replacement and safe disposal. If those filters aren't changed out in time, they'll be full of gunk and they won't do the job anymore. And of course, the more often you need to change it, the more money you're spending on your filters. So, you know, it's important to be thoughtful about using filters. Next slide, please. So I'd like to wrap up by recapping what I hope this presentation will help you to do to enable the choice to drink water. First, I hope you have a grasp of the issues as well as some common sense solutions. And I put some just kind of thoughts about that in the quote boxes. As physicians, your informed voices are respected. So maybe you can use your voice. And with that, I'm going to close with some ideas for advocacy. Slide, please. In terms of next steps to address the risk of lead in drinking water, here are 3 areas where you may have opinions to voice. First, around the action level. As you know, we lack a health-based benchmark, and I showed how there are trade-offs between a lower action level and the implications for remediation, including competing needs for funds, the relative risk of lead in drinking water, and how successful a given remediation method can be. And some advocates are quite active in California about lowering the level and filtering taps and stuff like that. But, you know, we need to think about all the trade-offs. Second, around testing. Implementation of testing protocols is not only too good, and we also lack clarity on how many taps and which taps should be tested. Also, should testing actually be mandatory? And thirdly, legislation at the federal level. In my opinion, all those state testing programs should be required to analyze to the non-detect level. Remember my graph where only 6 states and DC actually analyze down to 5 parts per billion? And if we could require that all states report all data back to the EPA, we could actually build a national database. Second, we've done well in recent years on funding for testing and remediation, but the job is not done. Currently before Congress, HR 1729, the Water Act, provides, is a very thorough bill, and a number of our California representatives are co-sponsors. I wonder if your representative is on the list. You can go back and check these slides later. Okay, one more thing. Next slide, please. The dietary guidelines for Americans, as you know, underpin regulations in our federal nutrition programs, as well as nutrition education for children and families and your medical advice. Although they do recommend drinking water instead of sugary drinks, the language in the guidelines could be stronger with more actionable advice. And the My Plate graphic, the nation's #1 nutrition education tool, could include a symbol for water the way dozens of other countries' nutrition graphics do. The Dietary Guidelines Advisory Committee is currently studying and deliberating to prepare recommendations for the 2025 to 2030 guidelines. And a comment period is open throughout this process. Actually, it closes on October 7th. They just announced that yesterday. A wide variety of stakeholders are advocating for USDA and HHS to take the necessary steps to add a symbol for water to the My Plate graphic. So you could take action by submitting a comment about why drinking water matters to you and in your practice, and what you think the guidelines on My Plate should include. In the handout, I put the URL to access the comment page, and also a website resource from the National Drinking Water Alliance that makes it very easy to submit a comment. Public comment is a great form of civic engagement that you can also encourage in your community. And slide, please, Nancy. That is it for my presentation. This is a poster from LA County Department of Public Health that I love. And slide, please. I think we still have about 15 minutes for Q&A. And I hope you have some questions for me, but if you don't have questions for me, I have some questions for you. And I also encourage you to email me, get in touch with me in the future if other things come up. Thanks, everyone.
Thank you, Dr. Hecht. That was wonderful. So we will give a chance for questions from the group. And then I think these questions you have also would be really wonderful to dive into and get perspectives on. So as a reminder, you can type your questions in the chat, or if you'd like to come off of mute, we can have you ask your question.
Thanks, Monet. Nice to know you're here today.
So while folks are, I'll have Nancy, if you could keep an eye on the chat while folks are kind of thinking of their questions. I think one question that maybe might be nice to hear your perspective on, and then in addition to some of those that you pose that we can ask the group, is just your thoughts and awareness of advocacy around just water fill stations, access, and kind of these environmental systems changes to improve drinking water access. We have fellows in our cohort that have been really advocating and working in that area. So just curious about your thoughts on that space, other collaborations or work that you're aware of.
Yeah, I'd love to talk about that. And first, I'm going to answer Araceli Gomez about impact on fluoride using a water filter. That's a really good question. I do know that the reverse osmosis systems remove fluoride. For that reason, I was pretty unhappy to see that when Oakland Unified School District installed filtered water stations, they used a brand that provides reverse osmosis. So it's just a good point to really think carefully about what your goals are with filtration, and what to know that every type of filtration is not the same. I put a resource in the chat to the National Sanitation Foundation. As you know, they certify filters in our country, and it lists all the different types of filtration, and gives you more information about that. About the, oh, you're welcome. About the water bottle filling stations, yes, those are so popular, and they allow people to get more than a sip. In fact, someone at Harvard did a study in schools where they measured the amount of water kids get from a water fountain, and it's like one of those little condiment cups at a fast food restaurant. So that's great to wet your whistle, but it's not really enough to provide a real drink of water. And kids seems to be so popular with them now to carry the water bottle, which is wonderful. but the bottle filler, gives them a good way to fill that up. We have been promoting at the federal level for years now the concept that Congress might appropriate funds so that every school in the country could have at least one water bottle filling station in a high traffic area. And that has been taken up by some organizations, for example, Robert Wood Johnson Foundation, but we're not there yet. And an interesting part of the problem is that we don't know how many schools have a water bottle filling station. Even in California, we didn't know that until just recently, but we did some recent data collection that may give us a better sense of where we are on that, at least in the state of California. So I hope that gives you a little answer to that question. Could be more to say. How often do you recommend to clean the aerators? I don't think there's a rule for that because it depends on the condition of your plumbing and how, frequently stuff breaks off your pipes and gets stuck in the aerator. But you might do it look at it, check it every month and see how it looks. I don't think it would, well, I just don't really know. I see a hand up from Laurel.
There we go. Hi, thank you. So I am with the Sonoma County Local Health Department and working with our champion provider, who I think is on the call, Dr. Ty, and he's done some research in the West County of Sonoma County, Guerneville area around water access and drinking water, and has found that there's distrust of the water out there, and that also that a lot of folks out there are on well water, and we struggle with how to communicate to those people. What would you recommend for communicating with folks that are on well water and are concerned about the potability of their water? What should they do?
Well, I actually helped mentor the dental student who was working on that project with Dr.
Oh, great. Dr. Ritzer. Yeah, wonderful.
So
You're familiar.
I'm pretty familiar with that situation.
Thank you.
Yeah, that's an interesting combination of circumstances. The problem with well water is that by law, well owners are responsible for their own well water. They're responsible for testing it. They're responsible for filtering or whatever is needed. And I have no idea how many well owners even understand that by law they're responsible, much less have the capacity or actually take action. So that's like one issue. The other issue, as I understand it, in Guerneville, but I'm not, my son lives in Guerneville and he says the water that he gets from that utility seems fine to him. So I think that, there may be some combination of organoleptics, and that's so personal, and also potentially some kind of community conversation that sort of sways people's opinion. As I pointed out, after the Flint water crisis, people's confidence in water dropped no matter where they were, what their actual water quality was. But in general, we saw a drop in confidence in tap water. So I don't think I really answered your question because I think you have a complicated situation there, but that helping people know the local utility so they feel like they have a tiny bit of a connection to it. Working with the local utility, I don't know if that's how much you've been able to work with that. I forget, is it West Country, or I forget the name of that utility?
It's Sweetwater Springs.
Sweetwater Springs, yeah.
Yeah.
Working with the utility to see what they can do to help
Yeah.
community. There are communities where they've brought people in to take tours of the utility, and that's been shown to really help. And also just help people understand, as I've said, the CCR and see what the deal really is, because I'm pretty sure that Sweetwater's water actually meets.
It's good. Yeah.
Standards. So it's an issue of organoleptics.
Yeah.
And that's not a safety problem, but
yeah,
can make people not want to drink the water. But going to bottled water, like now we're learning more about microplastics in bottled water, and it's expensive and so on. And filtering had the issues I mentioned. So this is what makes water really interesting. There's a lot of nuance here.
Thank you.
Thanks for bringing it up. Okay, we're running tight on time, but if you all have things you hear from your communities or other information that would be helpful, or you look at that resource handout and you know, you see things that are missing, I would love to know what they are. And unless other questions come up, I want to leave you with a thought about how to message the health risks of elevated lead in water. You know, it's clear that if a tap has a first draw sample and the lead level is 60, 100, 300 or something, there's a problem there. But what if the lead level is 10? What if it's 5? What if it's 3? Sometimes people hear that there's elevated lead and it's 3 or 4 parts per billion, and they get very nervous. And they don't understand, first of all, that, you know, going from exposure to blood lead level is one thing, right? And they also don't understand that we're talking about a first draw sample. So that's done intentionally to catch the worst case scenario. So anyway, I think it's really interesting to think about how to handle your messaging in those kind of gray areas around lower parts per billion. And of course, maybe another factor is what you think other lead exposures in that household might be. As I mentioned, water is not the primary source of lead exposure.
Well, thank you so much. Thank you so much, Christina, Dr. Hecht. That was really, really informative. And as you summarized with your last word, this is such a complex and nuanced topic. And I think it's just extremely helpful to have had you really dive into this with us and provide some suggestions on how to message when you're dealing with some of this complexity and how to truly advocate. A lot of great resources. We will be posting them soon within the next week or two, along with a recording of this presentation and slides. And so please reach out if you have any questions, and thank you for making yourself available if anyone has any follow-up questions to reach out to you with.
Absolutely. You know, we like to say that no matter what, well, as long as it's safe, water in any form is healthier than sugary drinks. So that's kind of the starting point for all this water work is as the healthy alternative to sugary drinks. Taking it back to where I started. Thank you, everybody.
Thank you.
Thank you, everyone.